All right, good morning, everyone. Happy Tuesday to you, or good afternoon, I should say. It is a very exciting time for Fresno County. Thank you so much for joining us on your Central Valley Live. My name is Gabe Salazar. Well, like I mentioned, great news for Fresno County. The state just updated its blueprint for reopening, and we are now in the less restrictive red tier. So, what does this all mean? Places like restaurants, movie theaters, gyms, and places of worship to open at a limited capacity indoors. So, in order to move to the red tier, the county needs to have a positivity rate of less than 8% or less and a case rate of 10 new daily cases per 100,000 people or less. Now, the county has to meet those metrics for 2 weeks in a row, and Fresno County met it last week. And so now to discuss is Mr. David Lucchini with the Fresno County Health Department, as well as Joe Prado. Thank you so much for your time today, gentlemen.
Thank you for having us.
All right, so it's an exciting time for residents in Fresno. And just to put this news into perspective, when was the last time we were in the red tier? Either one of you can answer.
That was a great question because I had to look back and see how far back it is. So we were back in red back November 16th, which seems like eons ago. But yeah, it was right between the holiday, the Halloween holiday, and right before Thanksgiving. So that's how long ago it's been since we've been in red. So
that is a long time to have those restrictions in place, right?
Yeah.
Yeah.
It is. It's been a long and winding road, but you know what? There's a great positive step forward. I think you're going to hear from me and Joe over and over, though, is this doesn't mean going to red means green light. Everything is back to normal. We have got to stay on track to do things correctly so we can continue the process of going down the color tiers, the orange, and then yellow, and then hopefully back to normal. But there's still a lot of stuff we got to do as a community together to get through this.
All right, and for the viewers listening who might not be familiar with the tier system yet, for us, what is allowed to reopen now that we're in the red tier?
You covered some of the key areas. Indoor dining can now go to maximum 25% capacity or 100 people, whichever is fewer. Retail stores can go to 50% capacity. Gyms and fitness centers can go indoors at 10% capacity. Movie theaters can go to 25% capacity or 100 people, whichever is fewer. I know there's a lot of people in movies. Zoos, museums, and aquariums can also go 25% maximum indoor capacity.
Yeah,
so those are some of the key areas.
Yeah, so this is really big from a health perspective, but also from an economic perspective, because this
Absolutely.
will mean more businesses reopening. And in the blueprint for reopening, some may see an unfair designation where restaurants, wineries, breweries are to reopen at some capacity, while bars are still required to be closed even as we move to the red tier. What's the science behind that to back that up and to back that kind of reasoning? Is this something that the state may be looking to adjust in the future?
It's a great question. I think our experts in the federal government and the state government have been looking at some of these high-risk activities and looking at Europe and seeing that sometimes in the bars they've seen some higher spread, the indoor capacities. But once again, we've seen changes before in the blueprint, so we anticipate we'll see additional changes as they study the further data coming from not only the state of California, but in this nation. So I always tell people, be flexible, be patient as things change over the time. But we stay in line with what the state recommendations are with the blueprint, and that's where we got to be.
All right, and just talking now about the vaccine equity metric. So why were some of the thresholds adjusted in that metric?
Yeah, I think, Joe, come in if you need to on this one, just because I just remember the governor was very big at first with the numbers in the health equity zip codes. We weren't seeing as high of a number. So this was a really way to push, saying, let's get vaccinated in our most vulnerable populations in the state of California. And in return, the state was going to open up, making it easier to get into the red tier, orange, and yellow tiers. And there were two major goals. One is the 2 million doses that was completed over a week ago to expand the red tier. And then the next one up, we hope by next week, will hit the 4 million doses, which will expand the orange tiers. Joe, anything on that one else on that?
Yeah, thank you, David. And that was a really good explanation. The only piece I'd like to add to it, there was some science behind why the equity lens was applied to vaccines. And it was because the infection rate throughout the state of California was higher in these equity areas. And so as we think about the most health burden, the most impoverished areas of our community, also rate. So overall, the science behind it, if you can control and vaccinate within these areas by prioritizing these areas within the system, you could essentially reduce the overall infection rate for the state of California as well. So there was some science applied to it as we saw the infection rates grow in these areas, and really being able to prioritize vaccination in these areas as well.
Right, and right now we're looking at a map to put this in perspective. Looks like we're seeing a lot of red and not a lot of purple, right? So that must mean we're moving in the right direction.
Yeah, I would like to see a picture from 4 weeks ago. It'd have been different.
Right.
We saw a lot more purple. So.
Yeah, so as you see here, they just updated this a few moments ago. Fresno County is now in the red tier, as well as Madera County and Kings. So definitely good news for all of us here. So how many doses of the vaccine have been administered so far?
Yeah, so within our vaccine distribution system, 384,000 doses have been administered to Fresno County residents. So that's a good jump from where we were a week ago. But also the Fresno County distribution system has actually done more than 184,000. Our distribution system, we vaccinate people outside of Fresno County, and so we have vaccinated to date 415,000 doses have been administered by Fresno County. And the difference for that is because not everybody who works in Fresno County lives in Fresno County. And so as you think about the Central Valley, there's a lot of movement in between our counties. And so at our vaccine clinics, we weren't turning people away who didn't live in Fresno County to vaccinate them, as we were operating under these occupation tiers. And so that's why there's a difference between the 384,000, the state reports for Fresno County residents, but our system has actually done 415,000 doses up to this date.
Right, and those are huge numbers again. And just pausing right there, because we hear that there's a lot of people getting vaccinated. Taking a look at some of the areas that are reopening right now. Here's a look at graphic. As we move into the red tier, retail, they can open indoors at 50% capacity, malls 50%, restaurants can now open indoors at 25% capacity, or 100 people, whichever is fewer. As we move into just the family entertainment areas, movie theaters can open indoors with 25%, or 100 fewer, and family entertainment centers like mini golf, batting cages, and go-kart racing can open outdoors. And as we take a look at gyms, a lot of people are wanting to just get their fitness game on, so they can open indoors at 10% capacity. As we consider the amount of people getting vaccinated and what can reopen like moving forward in the near future.
Yeah, so that's a great segue to reminders here. So when you get into a lower tier, the state requires that you stay in a tier for 3 weeks before you can go down again. So that means we have to remain in red tier for 3 weeks. Then if we meet the orange tier, and if we keep our positivity rates like they are now, which I want to highlight, our health equity positivity is now about 0.5 difference with our overall county health equity. So we've really narrowed that gap, which in the last couple of weeks was much wider. So I think that's a great telling story, working with our COVID health equity partners of really getting that gap down to the positivity rate. But if those remain in the orange tier, we have those once again 2 weeks in a row, and we've been 3 weeks in red, then we'll be allowed to go into orange tier. So that happened is April 21st.
Yeah, so it's 3 weeks
I don't
in
want
order
to get overly excited. We got a lot of work to do, remember?
Right, yeah. So it's 3 weeks in order to move down a tier. What if next week, say, those numbers go up and surpasses that threshold? Is there a chance that we might move
up? Are you
up?
going pessimistic?
Just wondering. A lot of people are wondering.
It's a good question, because we saw that back in the fall. If you get 1 week of purple numbers, let's say they're all purple, you don't automatically go up to purple. You have to have 2 weeks in a row. And then if there were 2 weeks in a row of purple numbers, then that could get you moved back up into purple.
So 3 weeks to move down, 2 weeks to move up.
Yeah.
That's one way to put it. Okay. And all right, and Joe, this is probably a question for you. Can the supply of vaccine demand moving forward?
Yeah, definitely. In Fresno County, with the amount of doses we're receiving to date, and the projection of the increase of vaccine supply coming in during the month of April, I think things are aligning really well. Supply is meeting the demand as of right now. And so as we manage those doses, there's an additional federal doses coming in to our federal program going straight to CVS, Rite Aid, and Walgreens. That is a federal pharmacy program, but also additional doses coming in directly to federally qualified health centers, which we have a significant amount of those in Fresno County. So those are additional doses on top of what we receive here at the Public Health Department. So right now, we don't see a supply issue. And in the future, if the state continues doses, both at the state directly and the feds continue to provide those doses as well, I think we're going to be at a good level of supply and demand. Now, I think April's going to open up tiers. You're going to see a huge draw, and we'll have appointments, and that's why we're looking at opening up additional rural clinics. We're looking at doing some more mobile clinics. So we're trying to be prepared for when the tiers open up April 15th. We got a lot more for people to go in and get vaccinated in.
Yeah, so this is just really good news on all fronts. So someone might wonder, if we are fully vaccinated as we move into having the next group of people down get vaccinated to qualify, can we actually start thinking about living our lives mask-free? How soon do you think that might be a reality?
That's a common question of when we go mask-free. Again, we've got to align very closely with the Centers of Disease Control and Prevention, the State Department of Public Health. You know, they've talked about a herd immunity when you're looking at vaccines around 70 to 85%. I think they've kind of leaned a little bit higher now because of these the variants that are going around in the United States. So we've still got a long way to go. So I'm going to go with some of our experts from the Centers of Disease Control. Maybe if everything goes into place by the end of the calendar year, early 2022 is maybe realistic. And that's, once again, how everything goes with the vaccine and how many people get vaccine and how these variants work. Yeah. Some of these variants are pretty tough. The Brazilian variant and the South African variant are keeping a very close eye on. So, and this is what we go back to, is why vaccines are so important, because the more people transmit the virus likes that. It wants to recreate itself. And this virus likes to recreate itself very fast. So we've got to slow that down. And this is where all of us have a part in this, to slow it down.
So as more...
Joe, go ahead. Some of David's comments is really the vaccine is one layer of protection. So the vaccine is going to be a key layer, primary layer of protection. The social distancing and the masking, we need all these layers of protection to really get us to a point where we don't have to wear a mask in early 2022. But we really want to be able to manage it so we can minimize the potential of any other surges happening in Fresno County through these preventative measures.
I think one of the great graphs, you guys can probably find it online, is that Swiss cheese graph, right? I think we've all seen that one. Look for the Swiss cheese, different layers that Joe was talking about.
All right,
the more layers you have, the less chance of transmission.
And as more people are getting qualified to get vaccinated, should we still worry about getting tested? Why can't we just worry about just getting the vaccine first instead of getting tested?
Testing is still important because, remember, we're trying to make sure what's going on, what's happening in our community. So that's why testing is still critical. Gives you an idea of what is our community, what if the variants are coming, are they spreading in our community? So testing is still a critical component that we continue to want to see. And I think our testing numbers actually went up a little better this last week in the report from the state. So that was good to see. It was much closer to the median rate. So I think we just can't depend on the vaccine. We still need to use that surveillance to see if someone has the virus.
Yeah.
All right.
Go ahead, Joe.
Yeah, and like David, silver bullet with COVID. To fight COVID, it's all these layers of protection, and testing is a key item that we have. It's a tool in our toolbox that we have to use. We need to know if there's outbreaks or clusters kind of creating in our community. We need to be able to go out there, do some contact tracing, and contain the spread of that virus again.
All right, and when can we expect people to get qualified to get the vaccine?
Yeah, so come April 1st, 50 plus will become eligible April 1st, and then April 15th, it's open to everybody. at 16 and older. And we say 16 and older because Pfizer is the only vaccine that is approved for anybody 16 years age and older. Moderna and Johnson & Johnson are 18 and older. It will be an open tier April 15th, but as of April 1st, it'll be 15 and older. And so April 1st no longer is it occupation. It's really anybody 50 and older, and all those previous occupations are still eligible to be vaccinated, but it's really entirely open on April 15th.
All right, so those are dates we definitely want to save, right? April 1st for those 50 years and older, and April 6th 16 years of age and older. And as we start thinking about sending our children back to school, I know Joe Biden said he'd want to have everyone vaccinated by May 1st. Do you think we'll open up the gates for people or children who are 16 years of age or older or younger to get vaccinated by then?
Yeah, so I think the May 1st is a good goal. I think within Fresno County, if you want to be vaccinated, you'll have the opportunity. There's going to be a lot of clinic sites available for you to be vaccinated. So if you want to be vaccinated, you could get vaccinated. Now, what will happen? What will the demand look like come in May? That's something remains to be seen on how many people want to get vaccinated. We do see vaccine hesitancy in our community, and we are working towards our messaging, doing direct education with our community-based organization groups. There's a lot of work to be done, even come in May. So I think for May, June, July, and the summer, we're going to work really hard for that other part of our population to get vaccinated. But there's still a lot of work to be done in the vaccine realm.
All right.
Background noise.
Yeah, sounds good. So is coming up. So for those who have older family members who are vaccinated, are we given the okay to go and visit them and just spend time with family?
Well, once again, the CDC recommendation is you could do some indoor with those who are fully vaccinated. It's been 14 days since their final vaccine in the series, or unless they got Johnson & Johnson, be one dose.
Right.
And if it doesn't, you're not vulnerable to have severe illness. So if you're not vaccinated and you're in a high risk factor, you don't want to be doing that. But if you're both fully vaccinated, then that allows you to do more indoors. But keep it small. That doesn't mean have these large groups again, right?
Right.
Let's keep it critical. We still want to protect our seniors. They've been looking forward to this, hugging their grandkids, and we want to support. Let's not take it to the next step where we have these large gatherings again, because then we go right back to seeing increases. So please have a safe Easter weekend.
And should we be concerned about variants at all? Have any of them been detected locally? And if so, should that affect our thinking about getting vaccinated?
Well, Dr. Vora mentioned in what last week, 3, Joe, cases of the variant. 4? So that's probably a low number. There's probably, the ones that we haven't detected. So we anticipate there's other cases that have that variant. So yes, we need to be aware of the variant. So far, the vaccine's still very effective with these variants, especially when you're talking about severe illness and hospitalizations. That's why we keep promoting the importance of these vaccinations. But the surveillance in the state and the nation is still ramping up more and more to get a better idea of these variants and where they're spreading to.
Right, so in the grand scheme of things, that's still a really low number, and there has been proof that these vaccine has some effect in getting us immune from those variants, right?
Yeah, especially the seems to be doing very well against that. Right. I think the one that we're keeping a closer eye on is, like I said, the South African and the Brazilian variant.
All right, sounds good. So as we wrap up here, what is your main takeaway as we move down the tier? It is big news for everyone here, but it's not a reason for us to let our guards down, right?
Yeah, like I said, I think I start off with that great song, Long and Winding Road. It's been a long more to go. This is a nice little bit of a celebration because at least some businesses can open up. We still got to do it safely. We don't want to go backwards. And we've been there before, right? In the fall, we were going forwards, and then all of a sudden we had that huge surge over the winter. So let's get vaccinated. Let's still use all those other layers we're talking about, the masking, the physical distancing, washing the hands. If you're sick, stay at home. And let's continue, hopefully, to the road to Orange, April 21st. Let's do our best to get there.
Main message from our side over here is get vaccinated, and also help your neighbor. Help a family member to register. Not everybody understands how to register online, but really be concerned and really reach out to somebody to help them to register to get vaccinated. Right now this system is operating. The system did 100,000 doses in 12 days. The system is ramping up. It is going to be there for when these open tiers are available to more of our population. We'll have more vaccine. We'll have those doses available. But really, be able to go out and really help somebody register to get vaccinated. Have a conversation with a family member at Easter on why are you vaccinated? Do you plan on getting vaccinated? Let that be the conversation over the holidays this weekend.
Right, and just so interesting that that's the topic of conversation, right? Did you get vaccinated? Did you get, yeah. So hopefully it all moves upward from here. And gentlemen, thank you so much for your time this afternoon.
Thank you for having us.
Thank you.
All right, so if you are just tuning in on your Central Valley Live, my name is Gabe Salazar. Just to recap, Fresno County has downgraded to the less restrictive purple tier. So what does this all mean? Well, look at some of the graphics here, you can visualize just what that means for us here locally. So retail businesses, they can open indoors at 50% capacity, malls 50% as well, and limited food courts. Restaurants can open at 25% capacity or 100 people. Movie theaters, this is a big one, and just considering family entertainment things to do, at 25% capacity, and family entertainment centers can be open outdoors only. As we take a look at the areas of personal care and health, gyms can now open indoors officially at 10% capacity. Hair salons can be open indoors with modifications as well. And as we just take a look at the regional news, this also means that Disneyland can reopen. So after being shuttered by COVID-19, Disneyland announced that they can finally reopen soon. So its theme parks, which include California Adventure, will be reopened on April 30th with limited capacity after closing down under California's coronavirus pandemic rules. So definitely some exciting news for all the families out there, and officials say the parks will operate at around 15% capacity. And Disney's Grand Californian Hotel and Spa will reopen on April 29th with limited capacity as well ahead of the parks. The Vacation Club Villa at the Grand Californian will reopen on May 2nd, and Disney's Paradise Pier Hotel and the Disneyland Hotel will reopen at a later date to be announced. So definitely some exciting stuff for us here locally and regionally, and hopefully it just goes all upward from. Thank you again for joining us on your Central Valley Live. Have a great day.